Hello everyone and welcome back to my channel. My name might be Isaiah and today we are going over abortions and miscarriages. Now I want to warn you, I'm about to get into the topic of sexual assault to start with as a sort of lens on why ace, trans, and other LGBT people might need access to abortions. So if you don't want to hear about that, I would skip ahead about a minute because I'm pretty sure I'll be into the actual topic by that point. Give everyone a minute. And so, why is abortion so important to talk about? Well, there is this idea of corrective rape, be it for an asexual person, a trans person, a lesbian, a homosexual man, whatever, where the person that is doing the assault will decide that you're lying or they can fix you through coercive sexual action or rape. And that can end in pregnancy if the person being attacked has a uterus and ovaries and all of that junk that means pregnancy or that you can carry a pregnancy. This is especially heinous with people who are FTM trans men because if you are a trans man, you already have harder access to quote unquote women's health services because of your gender marker change and your physical appearance. People will feel like they need to deny you because you do not look like a woman. Therefore, you clearly don't have the issue. So they can be denied the help that they would need for, say, uterine cancer or pap smears or any sort of thing. And if a trans masc person with a uterus ends up with a pregnancy, depending on the state laws, their doctor may withhold testosterone from them so that it doesn't adversely affect the fetus. It's because while testosterone does not completely sterilize you, or there's a good chance that it won't, you also have to be aware that testosterone can have adverse effects on the fetus. And in some places, it can, if you do have like a miscarriage or an abortion, it can be counted as manslaughter, and the doctor can be affected as well. So they will withhold the T so that they don't get like a criminal conviction. And this is also very important for asexual people because, as I've mentioned before, this sex ed series is meant to be inclusive of ace people. Ace people can also be victims to the corrective rape or the coercion because other people have a fundamental misunderstanding of how asexuality works, and it's just a whole thing. So, what is abortion? Abortion is the intentional ending of a pregnancy. And there are actually two different methods that are typically used. There is the medication method, and then there is the surgical method. We'll go over the medication one first. So, the medical abortion is you take like a combination of medications that basically induces a miscarriage or the ending of a pregnancy. It's typically you take some medication orally and that causes your pregnancy to stop growing, and then after that you will include other medication through the vagina, and that will cause your uterus to cramp and you'll essentially have severe cramping, bleeding, and this is all done at home, and you have a very heavy period essentially. And then you'll go back to the clinic, make sure that it was successful, and then you're done. It has about a 95 to 97% success rate, and other people will, the ones that don't have a total success will then go on to the surgical method, and this is most effective early on in the pregnancy, like 4 to 9 weeks since the start of your last menstrual period. The surgical abortion is also called the suction curettage abortion. I'm really hoping I'm saying that right. Where essentially you'll go in and a doctor will insert a speculum, which a speculum is that weird little tool that helps them to widen the vaginal canal so they can see what they're doing. They will then numb the cervix, which is the little donut at the end of your vaginal canal that kind of is the entrance to your uterus, and it stays nice and tight most of the time, unless you are having a period, which then will soften so that it can release the uteral lining, or it will stay nice and tight because that will help. If you're pregnant, it will help keep the pregnancy in the womb. So they numb the cervix and they gradually widen it, also known as dilation. That's why you hear about dilation when people are going into labor in like those doctor stories, because that means that the cervix is widening. Then they will place a tube into the uterus and suction is created either through like a little machine or a handheld syringe, and that helps empty the pregnancy from your uterus. And that is more of a 98% chance, and very few people need a repeat on the procedure. So those are the two types of abortion, and people tend to think that the second one, the suction, can be all the way up to third term, but usually that's done before 20 weeks, and a full term pregnancy is usually considered completely done at like 37 weeks. Then the fetus is completely viable outside the womb, typically, yada yada yada. Um, so those are the two types. There's also this scaremonger of really late term abortions, but really in the US especially, only about 1% of abortions are so late term. And there's a variety of reasons that someone may have a pregnancy, an abortion after 20 weeks. Anything from it's a first time mother who is very unfamiliar with the procedure to extreme medical issues. Like, there's these very scary terms like preeclampsia and that sort of thing, where essentially the mother and the fetus are both at risk, and the people that usually get to this point are, especially if it's a medical condition, they are having an extremely difficult choice about if they want to try and push through this pregnancy at the risk of the mother, and sometimes both the mother and the fetus, or if it would be safer to terminate and perhaps try again later. Then you also have people that are in extremely unsafe conditions, that sort of thing. But it's a very, very low amount of people that choose to have an abortion after 20 weeks. And a lot of it could be mitigated even further by having easier access, easier resources to abortion, or early term abortion, whatever you want to call it. So that's really it about that sort of thing. There's a lot of scaremongering from right wing pundits about how abortion is killing a baby, but most of the time when people are choosing to have abortions is before there's even really a viable fetus. They would not be able to exist outside of the womb. Even with medical intervention, they're usually just a cluster of cells. And I would say that the stigma around abortion is actually part of why there is such heartbreak and heartache around the idea of abortion, because regardless of the reason that a person is having it, they will still have some sort of psychological response, with a lot of people ending up feeling really guilty about it and going through grief, which is totally fine, because even though you could be the most logical person and know that this is not even a viable fetus yet, but you're still choosing to end a pregnancy and end a potential. And I think the left wing people don't put enough emphasis on the fact that this is something that can greatly affect someone's mental health. And yes, part of it is from societal pressure, but part of it is just the knowledge that you've chosen to do this. And for many people who have grown up in this society, it can leave you feeling really guilty. So I do believe that we need greater emphasis both on easier access to abortion methods as well as day after care, but also greater resources and understanding of people who choose to have abortions but then have to go through a grieving process. Because that's just where I'm at personally. So we've gone through abortion. Now, what is a miscarriage? A miscarriage is basically your body choosing to abort a fetus on its own, usually super early on. And miscarriages are actually super, super common. Like 10 to 20% of all pregnancies end in miscarriage. And the number might actually be higher, but we wouldn't know because a lot of very early pregnancies that end in miscarriages aren't even caught on as pregnancies. Now, why might a miscarriage happen? It could be a fertilized egg has an abnormal amount of chromosomes. This is completely random, so you have no control. Certain diseases like severe diabetes can increase the chances of having a miscarriage. A very serious infection or major injury, not something as simple as falling down the stairs or whatever, but something like getting extremely hurt, going into a car accident, that sort of thing. Um, Late miscarriages, like after 3 months, it can be caused by abnormalities in the uterus. And then if you've had more than 2 miscarriages in a row, you are more likely to have a miscarriage. A good example of the latter would be, like, say, the Duggar family. They're in the news right now, they're relevant. Mrs. Duggar, the mom, she's been having more and more miscarriages the older she gets, just because the older you are, the less viable eggs you have in your ovaries. And so they could have issues. And then also the uterus is older, just everything is older, not working quite as well. So it's more common to have miscarriages the older you are as well. Now, there are a couple of different types of miscarriages as well, with the idea of a threatened miscarriage, where you may have a little bit of bleeding, a few cramps, but the cervix stays closed. Half the time it stops and you go on normally. The other half, it becomes an inevitable miscarriage and ends in pregnancy lost. Incomplete miscarriage is where you may have some of the pregnancy tissues leave and some stay inside. You would need a follow-up to make sure that the rest of the tissue is removed. A complete miscarriage is the opposite of that, where all of the pregnancy tissue comes out. And then a missed miscarriage is when you don't have any of that stuff, but an ultrasound shows that there is an embryo without a heartbeat or an empty pregnancy sac without an embryo. Usually this passes on its own, but you may need treatment. Treatments usually include medicines or procedures that are actually similar to what we talked about with the abortions, which is why I did abortions first. Miscarriages can also be extremely dangerous if they're not treated. Like, say you have a missed miscarriage and your body's not releasing the tissues, that has a chance to get really bad and go toxic in your body. And we've talked mildly about toxic shock syndrome. So imagine if it's your own tissues that are going bad in you. So it's a lot. And just like with post-abortion mental health care, it's also important to realize that people who have miscarriages and are aware that they've had a miscarriage, especially if this is a child that was wanted, or, you know what, regardless of if the child was wanted, they may experience some sort of mourning process or grieving process, because there's once again this conception and this societal pressure that if your body, especially if you are a cis woman, if your body's not able to carry a pregnancy to term, then you are lacking in some way. And in the US especially, I tend to blame this off of the severe Christian undertones that permeate our country, as well as everything surrounding it, where women are only good for baby making and homemaking. So, despite how far we've gotten, there is still this underlying pressure. And I would argue this underlying pressure also exists in anybody who has a uterus, regardless of how they identify. regardless if they were socialized as a woman growing up, because the idea is if you have a uterus and eggs, you should be able to carry a pregnancy to term and have children. And some people do want to have children, and it's just a lot. But today's video is a little shorter. It was a serious topic. Well, I say it's shorter, but this was a serious topic that I felt like needed to be discussed because, once again, warning, I'm about to talk about sexual assault. But the idea of coercive rape or corrective rape is extremely prevalent and way more common than what people like to talk about, because that in itself is its own traumatic experience. And if you are asexual, or if you are transgender, or a lesbian, or anything else on the LGBT spectrum, you are more at risk of corrective rape than you would be if you're a cishet person. So it's important to know your options, what you can use for birth control, what would be safe with you and your body, as well as your options after something happens. So I would check in with your state laws, check in with your country laws if you're not US. And other than that, I would suggest be safe. If you are sexually active for one reason or the other and you don't want to be pregnant, use protection. And other than that, y'all have a good day. Try not to let a heavy topic weigh on your mind for too long, because your brain needs a break from this world that just constantly barrages us with bad information and bad news. But yeah, have a good day. Stay hydrated, stay safe, and I'll talk to y'all tomorrow. Bye.